Good morning.
Good morning, everyone.
Morning, Olivia. Oh, okay. I think I'm doing
Oh,
it.
it's you, Wiggy.
Yeah,
It shows you're a number.
I know. I didn't do it, and then I don't know how to do it, and then forget it. That's fine.
It's okay. We know it's you. We know it's you now.
Yeah, Santa here. Hello. Hi.
Michelle. Hi, Michelle.
And then there's a son.
Morning.
Good morning.
Oh, you have the
Hi, everybody.
Good morning. Hi, Anne.
Yeah.
All right. We're just waiting for a couple more, and I think Anna still
Long.
has
Not.
joined us. And I see Nurse Elenita's here. Good morning, everyone. Just giving a few more minutes for people to join us. All right. Okay. Give me a second. Lupe, can you take over the waiting room while I just check on Anna?
Yes.
Thank you. All right. She just said give her 2 minutes and she'll be joining us. Thank you, Kathy. Kathy shared if you recently received rapid tests from Children's Council, be sure to check the expiration dates. Good morning. If you're just joining us, we're giving on a couple more minutes to join us. She's running a little bit late. But it's good to see you all. Good morning.
Good morning.
Thank you, Nurse Alanita. So while we're waiting for Anna to join, and Sherry here, she's coming in. Hi, Anna. And I see Vincente is joining us as well.
Yeah, sorry, we were late. We were just getting clarification on all the upcoming guidance that's going to be coming out. So we have the latest news for all of you.
We're getting the hot off. Wait, not on the
off
presses
the
yet.
press. You're getting a preview.
Preview. Okay, great. So we can get started. Good morning, everyone. Thank you all for joining us. I think I know that loop, so we're going to be juggling some, trying to jot notes and as well as letting folks in today. But good morning, everyone. Welcome to our final open and reopening session today. Of course, it's not going to be the only time we get to connect, but in terms of this meeting, we are going to wrap this month. And Anna and Vincente from DPH is here to share with us some of the updates and some additional resources kind of moving forward on guidance. So with that, I will hand it over. Do you need to share screen, Anna?
No,
Okay.
we were not. Because this is such a preview from the last meeting, we don't have anything in slides. I do, in case I didn't do this last month, I do want to introduce Vincente Cordero. He has joined our team. He will be the lead for schools and childcare for COVID, and I will continue to work with him, but he will be the main person you're interfacing with. So Vincente, would you like to say a few words?
Absolutely. Yeah, thank you, Anna. Hi, everybody. My name is Vincente Cordero. I have been with the COVID task force for a little over a year now. I originally was part of the community engagement branch, and a lot of the work that I did revolved around directly engaging community members and working with them. And I have since transitioned into a role with the Schools Hub, and I will be liaising on behalf of the department with all of you. So look forward to getting to engage all of you and talk to you more about this process as we go forward. Thank you.
So recognizing time, we're going to give you the updates that we have so far in terms of COVID. And then we also want to talk a little bit about monkeypox, just because I'm sorry if you're not speaking, could you please mute? Thank you. Just because it is been a bit of a topic in the news lately. So with respect to COVID, as you probably all know, the San Francisco Department of Public Health retired our local guidance for both schools and childcare. And we also retired all of the individual documents. And now we're going to be pointing to everything from the state. The state has a separate guidance for schools versus childcare. And it is my understanding that the state is working on an update to the childcare guidance. I don't think it has been published quite yet, but it is coming soon. And so when that comes out, we will be able to distribute it to you. But a lot of the concepts are very much the same. Masking is recommended. It's not required, but it is recommended. We're encouraging vaccines and boosters, especially for the staff that are older. And now vaccines are out for our littlest ones. And San Francisco is doing an amazing job in comparison to the rest of the state and the nation. And, if someone tests positive, then they should still, the only requirement is that they need to isolate for at least 5 days. And then if they're a close contact, they should get tested 3 to 5 days afterwards. So many of the recommendations are still the same. Right now, our team is working on a protocol for both schools and childcare to report outbreaks. This is not for individual cases. I know childcare needs to report to your local licensing regional office when there is an individual case. But if we are working on a protocol, if there is an outbreak, and this means that there's, more than one case, we're working on all those definitions. We should have that out within the next week or two. And we'll be sure to send it to our listserv, and then Olivia will make sure that we send it to you because you can send that to the groups. And I think those are all the main updates related to COVID. And just want to highlight that there is a lot of media about the possibility of vaccines that will be available this fall that are very targeted to the Omicron variant and all of its subvariants, which is sort of what we've been dealing with all summer. So I'm going to pause there and see if there's any questions. I already see someone from Angel about the previous recommendation is we want to get children to get tested on day 5. And if it's negative, they can leave isolation. That is still the case. So if they have to stay in isolation for at least 5 days, and then starting on day 6, if they start testing negative, they can leave isolation, but they must wear a mask. If they continue to test positive, they need to stay in isolation. Past day 10, there's no need to test. They can leave isolation. So that is basically still the same. Is there any other questions related to COVID? So Vincente, once we have this outbreak protocol developed, we will, Vincente will send this out to the group.
Erica has her hand up. Go ahead, Erica.
Hi, quick question. I know that the guidance says immunocompromised people might need to isolate for up to 15 days. Are children considered like immunocompromised because they're younger, or it's not unless their doctor tells them to?
It really all depends on what their doctor says. So if an infant has had an organ transplant, for example, that would actually be considered immunocompromised because they have to take a certain medicine for the rest of their lives, and which represses their immune system. So that I think that is an individual case that they need to talk to their doctor about that.
Okay, thank you.
And Olivia is asking about the second booster. It can be, the second booster can be for anyone over 50. It doesn't have to be that it's either you're over 50 or you have an immunized compromised system. It's not an and, it's an or. Thank you, Olivia. And Adelina, your question about continuing to require non-vaccinated employees to test weekly, can you do that legally? That is a question between you and your legal counsel, but I know that is still a requirement from the state for schools, TK through 12 schools, but that's not a requirement for childcare. So that's really up to your organization. And thank you, Vincente, for putting links in the chat. It's really appreciated. So any other questions on COVID? Or we'll start to talk about the latest and greatest health topic of monkeypox. Okay, well, silence means move on. So just a quick overview on monkeypox. We are working on a schools guidance and a childcare guidance on monkeypox. We do hope to have that out in a couple of weeks. Right now, according to the demographics, the vast majority of these cases are within the LGBT community, and about 98% of them are with adult males. However, this disease is not exclusive to the LGBT community. And there has already been 2 cases in children in the United States. So we are just putting out preventive guidance just in case. Letting everybody know monkeypox is a virus that comes across as a rash on a skin. And it can spread through close skin to skin contact. This is not like COVID. This is not airborne. You can't get this from breathing in the air. But this is also not like a sexually transmitted disease where you're exchanging bodily fluids. This is skin to skin contact. So we know our little ones like to hug each other and kiss each other and are very physical, as they should be for their developmental age. So we are putting together some guidance, but some preliminary things to think about is to look, first of all, this could look like chickenpox. This could look like any other kind of rash. And just like any of that, if parents and caregivers should keep their kids home when they're sick and take them to the doctor to get tested. And it could very well likely not be monkeypox, but any of those should not be coming into your childcare community, as you all well know. But we all know sometimes kids come to childcare anyway. So if you see any kind of rash or bumps or lesion, you should cover it with a bandage with sealed sides, like not quite gauze, but has like a really huge Band-Aid that's sealed on all 4 sides. It's not you should not share any bedding or clothing. So children should have their individual nap cots and their nap sheets. Things like dress up, you should probably consider not sharing any costumes or clothing or dress up, things like that. And again, we're going to be putting all of this in our guidance. And then again, stay home when sick. And if you hear of any adults in a family's household that have monkeypox or a rash, just pay particular attention to that child. But we're not closing schools, we're not closing childcare, and we're not putting out any masking orders or restrictions like we did for COVID. And as soon as we have any guidance on that, we will, again, Vincente will be sharing that. I have a copy of a flyer that I can put in the chat. It's a very general flyer. It's not specific to childcare, but it gives you an idea of what monkeypox is and what to look for. So I'm going to pause there and see if anyone has any questions. And Elenita has also put a link in the chat about how monkeypox is spread, which is, again, not airborne. Does anybody have any questions?
Yeah, Anna, I just want to mention, because monkeypox, they're still researching if it's can be through respiratory droplets. The scientists are still researching, so stand by. But right now, I think my understanding is it's mostly direct contact. So stand by.
The health officer has shared with me and others that for all the cases that we have seen so far in San Francisco, it has been direct skin to skin contact.
I was just referring to the CDC
Yeah.
information. Thank you, Anna.
And there are the only long-term effects due to monkeypox depends on where the rash comes. I have read that like if there's some lesions like near the eye, it can maybe cause some temporary vision issues, possibly long-term. But other than that, it's certainly not, this version of monkeypox is not fatal. Very rarely does somebody have to go to the hospital. It doesn't cause anything like pneumonia, which COVID did in the very beginning of the pandemic before vaccines. But it can be really itchy and it can be very painful rash. We do not have so I'm going to go to the chat. How to distinguish monkeypox from other rashes? You shouldn't. If you see a rash that you think is suspicious, you send that child home and tell them to go to the doctor. It could be chickenpox. It could be eczema. It could be something completely mild, but that should not be for you to judge. You just send them home and have them go to their doctor. And in terms of having information on monkeypox in other languages, we do have an outreach toolkit. Vincente, do you happen to have the link to that, or I can look that up real quick?
I had posted a couple of links in chat, Anna, to the FAQ and to our general city guidance regarding monkeypox, and I'll also post the link to the toolkit right now.
Yes, thank you. And there are posters in English, Spanish, Chinese, and Filipino in that outreach toolkit. Again, they're general posters. They're not childcare specific, but they have information on them. That's very useful. I see Erica's mention in the chat. I do not know the quarantine time for monkeypox. Maybe Vincente, would you mind writing that down and we can get an answer for that? The best way to protect the rest of the family is if the lesions are covered. Again, it's shared by all the cases in San Francisco have been skin to skin contact. So don't share clothes, don't share bedding, have the lesions covered, sealed on all four sides, like a really big Band-Aid that, that has like seal on all four sides. I'm sorry, I'm doing this to my arm repeatedly, but gauze isn't enough. And then just make sure that's covered is what the clinicians have shared with us. They don't need to isolate away from their family. You don't need to cancel events. They just need to make sure everything's covered. And then talk to the doctor about treatment. Treatment is pretty limited and the vaccines are very limited. And I'm not sure they're approved for, I don't know if they're approved for children or not, but right now there's so few supply of vaccines that we're prioritizing those that are LGBTQ that meet certain criteria because they're the ones that are being the most impacted and most exposed right now. If there is an individual diagnosed Elenita, they should call CD, yes. Well, their test results would be reported to CD anyway. But yes, you can call. Yes, absolutely. But people could call or email, and I'm sorry, I don't have that number handy, but the test results will be reported to us immediately, especially if it's in a school or childcare, we would know pretty quickly. Thank you, Elenita. Any other questions on monkeypox? I saw there was a couple more questions on COVID, but I want to wrap up the conversation about monkeypox before we move on. Olivia is asking if the rash or the sore section is the contagious part. That is my understanding.
Anna, my understanding is the blisters has the fluids, and the fluids, when you touch it, that's where the virus are. So that's the reason why it's direct contact. But anyhow, I think they are still researching if there's any other bodily fluids that can contain the virus. So that's the reason why direct contact is currently the mode of transmission right now. That's my understanding. Thank you.
Thank you. Any other questions about monkeypox? Last call, or I'm going back to the chat on COVID.
I'd like, Anna, is it okay if I just mention, I'd like to find out if any of our childcare centers are interested in a presentation about monkeypox, because childcare health program nurses are receiving some inquiries. So I'd like to know if there's gonna be another presentations besides the information you provided, or is there any request from other childcare sites?
Well, I think Olivia said that this is going to be the last, would be the last meeting of this, but if there is a demand for monkeypox presentation, I'm sure we could arrange for that. I think the priority is actually to put out our guidance first, and then we can convene one other meeting and review the monkeypox if needed.
Thank you, Anna.
So I want to go back to, I think it was Adelina asked a question about, follow-up question on testing, testing weekly. At this point in time, we are not recommending weekly testing of everybody. We are only recommending testing if someone has symptoms or is considered a close contact. We are also, I think the state has put in their schools guidance that if there is a break or like holiday travel, and then the school site is closed, and this is something that childcare sites can consider adopting, that you could test everybody before you come back. So for example, obviously school will be starting in a couple weeks for TK through 12 grades. And one of the recommendations is to test the entire student body before school starts. Stephanie is asking, can I clarify what the protocol is if a child has symptoms and tests negative? Believe that there is guidance about having the children retest 2 to 3 days afterwards. If a child has symptoms, but they are testing negative, you can keep them home. This depends on the type of test. If the test is a PCR test, you can be pretty confident that that child is negative. If the child is symptomatic and let's just say a little bit of a sore throat, but not really severe, and tests negative with a home test or the over-the-counter test, you could recommend to keep the child home. There is some cases where they will test positive 2 or 3 days later as the virus starts to build up in the body. And then if the child still continues to test negative, with a home test 2 or 3 days later, that means they're negative. Does that make sense, Stephanie?
Yeah, that does. I guess I can't remember if it was on the CDC or the SFDPH, but I just know that sometimes with like you were saying with the rapid test, the rapid at home tests, that kids can test negative and then a few days later, or people can test negative and then a few days later they could test positive. And what the protocol we've been doing is if you test negative, you're clear to return. But obviously I know the reliance on the at-home tests have kind of been a little more inconsistent. So I just wanted to know if there was like a more clear-cut guidance on, okay, your child's test negative, we still recommend they stay home for 2 to 3 days, even though you've already submitted a negative test. I don't know. I just
That would only be for a home test, as you talked about. Yeah.
okay. So it sounds like you're recommending PCR tests in order for them to return.
Well, no, not everybody has access to PCR tests. So I would say that people should just get tested as soon as they can.
Okay.
Whether it's PCR or over the counter. And then it could, if it is over the counter and the symptoms persist, an institution and an organization can recommend to keep the kid home or staff member home for a couple of days and retest just to make sure of the test result, but only if it's over the counter.
Okay. Thank you.
And I see Diana's comment.
Yeah.
Go ahead, Diana.
Yeah. He was, every time he was with someone who tested positive, he also had symptoms. But then when he did the test, doesn't matter home test or PCR test, always come out negative. So I read something about the worst cases like that. And even though the people having symptoms, they still can test negative for some reason. I don't know why.
That's really interesting because ultimately you're only considered a positive case if you have a test result that's positive. So
yeah, that is just very, very strange to us. I mean, we were saying you must have it, you must come out positive, still came out negative all the time. Yeah.
So from our perspective, then that person was never positive. That person is negative.
That's right. But then he would give it to someone else though, right? If he was hanging around with other people who.
But he could have, so I can't comment on this case. I don't know the individual's ins and outs, and that's something with that person's healthcare provider. But what I'm saying is a person cannot be considered having COVID unless they have a positive test result.
Yeah. Yeah.
Anything else? It is 11:33. I want to thank everybody for their hard work. It's been a hard 2 years. So thank you.
We want to thank you and your team for all the work and the support that you've provided to all of us as well. And I know even though this seems to be the final, but I know that we'll stay connected, and we appreciate the behind the scenes that you and your team has really worked hard to support us in our field and advocate for us. So thank you on behalf of all of us, and you see the many thank yous in the chat from everyone as well. So,
Sounds good. Thank you,
thank
everybody.
you.